Hello, Redefine Her listeners. Thank you for being here. We are certainly in some weird times, folks, but weird times give us a chance to do wild things. And as much as healthcare shouldn't be wild, even more so, healthcare equity shouldn't even be up for debate, here we are. In this country, Black women remain deeply underserved. In fact, healthcare outcomes across the United States are far and away worse than any other affluent nation. And it's not just a health crisis. It's a moral and economic one too. But today's guest, she is not waiting around for someone else to fix it. Tesiah Coleman, co-founder and chief clinical officer of Kyndred, is on a mission to redefine care. And it all starts with one bold idea.
It's really about cultural relevance of having these important cultural significant experiences, lived experiences that the clinician can draw on to engage further with their patient. This helps with treatment compliance. This helps with diagnostics. This helps with so many different things that weigh heavily into outcomes.
In this episode, we are going there. We're talking about the systems that continue to fail us and the women who are rising up to rebuild it from the inside out. We're talking about motherhood in a world that feels like it is on fire. We're also talking about the right to change your mind and the power of collective action. And we have to acknowledge this moment we're living in. The weight, the rage, and the need to stay grounded and brave and take care of ourselves and our communities. If you're realizing that the leaders that you thought you could trust aren't serving all Americans, it's really okay to question what's right and wrong. So I invite you to broaden your awareness, check your privilege, and take the opportunity to be a better ally. By tuning in to Redefine Her, you are doing just that. Season 2 starts now. Thanks for tuning in. Today, we are joined by my guest, Tesiah Coleman. A devastating cancer diagnosis for someone she loves rattled her to her core. And instead of just surviving it, she decided to transform the system that failed her and her family. Tesiah is a dual board-certified nurse practitioner, clinical strategist, and health tech leader with over a decade of experience in reproductive health, primary care, and digital care delivery. She's scaled virtual clinical teams, led multi-state expansion, and built equity-focused care models at companies like Tia and Violet. And now, as co-founder and chief clinical officer of Kyndred Health, she's building a race-concordant digital-first health home for Black women, redefining what care looks like through trust, technology, and cultural relevance. Welcome to Redefine Her, Tesiah. I'm so glad you're here.
Thanks. I'm really happy to be here.
We're both moms, as we were talking about at the beginning of our chat today, raising boys in this crazy world. And we're both women and entrepreneurs. And you had a really devastating experience, something that is probably every mom's worst nightmare. Your son was diagnosed with cancer, and that really became a catalyst for you. Tell us a little bit about that experience and what changed for you in that moment. Not just personally, but really how you saw the healthcare system.
Yes, my son Oliver was diagnosed when he was 6 years old. This was October 2020. So we're talking early pandemic. We're still in that lockdown vibes. I don't know if your neighborhood did the bear hunts. We're baking bread. We're doing all of that stuff. So early pandemic, he was diagnosed. And at the time, I was a practicing nurse practitioner in a community health center. And that's basically what my dream was. When I went to school, I wanted to work in community health. I wanted to work with predominantly underserved, under-resourced, marginalized folks. And I wanted to bring them really high quality care. And so that's what I was doing in a very under-resourced community health clinic. And then the pandemic hit, and that was obviously an extra strain for this clinic and for myself as a nurse practitioner. I was providing mostly prenatal care to a lot of undocumented folks, a lot of Black folks, a lot of people on Medicaid. And so it was just a hard time. And then when my son was diagnosed, I really reached to my leadership at my community health center to be like, hey, my son's immunocompromised. I can't keep coming into work. I need to do telehealth. And which is something we were doing at the time. I just also was going into the clinic, and they were really not receptive. They pushed back a lot. They were really not willing to work with me, even though I was seeing 30 patients in a day, like 25, 30 patients in a day, really intense patient load. And I was doing it for what you get paid in a community health center. And even though all these things are true, we are very inflexible in the traditional healthcare model in how we treat our employees, how we treat our patients, how we create protocols. All of it is very immovable in a lot of ways in traditional healthcare. And so that's what I was experiencing. I had experienced it before in my professional life, but I was experiencing it then in my personal life when Oliver was diagnosed. And so I made the decision at that point to really shift how I provided care and to move into health tech, and really looking for a company that was willing to be flexible with me as an employee, but also was more forward thinking in how we could change the system during a time where a lot of change was necessary.
And a lot of change certainly happened. I think some at a super accelerated pace and others a lot slower than we would wish for. And the world continued to be on fire for years, as it continues to be now.
It is.
So, what did you take from community health as a nurse working in that environment? You worked in gerontology as well, right?
Dual certified in women's health and adult gerontology primary care. For the clinic, I mostly did all prenatal care, and then I did some primary care across the lifespan. So from 12 years old to 80 years old.
And what did you take from that into health tech? How did you want to cross that bridge?
The people who work in community healthcare, particularly, are some of the most adaptive, quick thinking, very scrappy people that I have ever met. And that is something that's really necessary and very transferable to a startup environment. You need to be scrappy. You're constantly pivoting. You're constantly thinking about, okay, this is working. This isn't working. How do we shift things? And you're given the opportunity to move at a lot quicker of a pace and to get more change done in a shorter period of time. That's encouraged in a way that it isn't necessarily in the traditional healthcare system. But I think the skills that I developed in community healthcare, the ability to be super creative and how we were getting patients different treatments, medications they needed, the time we were spending, we didn't have a lot of time. So all of those skills of how to put the patient first in an environment that is not set up to put the patient first, I think those are skills that I brought with me into health tech and made me a better operator and leader in the startup, health tech, femtech, whatever you want to call it, space.
As I've been doing some research, I don't think this is a unknown fact. I think people are a little ignorant to it, but Black women are not just patients in the healthcare system. They are powerhouses in the healthcare economy, spending billions every year out of pocket care for themselves, for their family, for their communities. But yet they are the most likely to be dismissed, misdiagnosed, or we saw it just this fall, women are dying in childbirth. This is across the spectrum, but it more predominantly impacts women of color. And it's not a health crisis only, it's a moral failure on our part. And it's an economic problem as well. So tell us a little bit more about Kyndred Health and what your goal is with this new platform and new initiative on your part.
When I joined TIA, it was the start of the push to make women's health mainstream, especially in the VC world, in the health tech world, to really say, hey, actually, we're not niche. We're not just this extra side. You can't just apply male approaches to us. And so I was really involved in being able to actively witness and participate in that shift, which was incredible. But what I noticed as a huge lack in that shift was women aren't a monolith. We do not have the same experiences, especially in the United States. There's a huge gap. There's huge disparities between how Black women experience care and what their outcomes are, and how white women experience care and what their outcomes are. What I noticed in lots of the companies I worked for, consulted with, is that the default user in many cases was a relatively wealthy, white, well woman, and that was who was being built for. It wasn't chronically ill patients with multiple different diagnoses that were having to navigate care. It wasn't your Black mom who is trying to deal with racism that her kid is experiencing at school and get into her PAP. And then she shows up for her PAP and then she experiences racism. That's not who we were building for. We were building for a very specific, actually, default user. That's what we were calling the default. And so that is what I witnessed firsthand when I made the transition into health tech. And that is really both from my own personal experiences and my professional experiences, what I wanted to solve for with Kyndred. And, I was really lucky with Kyndred to be approached by, or now my co-founders, two other Black women who had already built a company that really focused on Black women's sexual and reproductive health education. And so they had already 7 years of both success and firsthand market research with Black women in New York and California, telling them exactly what it is they wanted. But no one had built that. And so really when they approached me and we started to dream up what could Kyndred be, it was this conversation of, well, we actually know exactly what to make Kyndred because
we've got all this evidence.
Thousands and thousands of women have told us what to build, just no one is building it for them. And so how do we step in and fill that gap?
Yes, awesome. So speaking of that, break down race-concordant care and why it matters.
So race-concordant care, I find it really important to mention that it's not just about race matching. It's not just about this clinician's Black and this patient's Black, so let's match them. It's really about cultural relevance of having these important cultural significant experiences, lived experiences that the clinician can draw on to engage further with their patient. And this helps with treatment compliance. This helps with diagnostics. This helps with so many different things that weigh heavily into outcomes. Also, for race concordant care, sometimes I feel like people can get a little bit like, oh, shouldn't everyone be able to treat everyone? But in the reality of our situation right now, we actually already have race concordant care and it's just for white people. The majority of doctors are white. The majority of providers are white. And so when a white person goes into a clinic, they are more likely than not to see a white provider. And so we already do have that in a lot of ways, and there's cultural touch points for them as well. But for Black people, and there's also been studied with Hispanic or Latinx patients, there is a special benefit that isn't witnessed in, let's say, a white to white race concordant relationship for those populations. And that's because of the marginalization. It's because of this extra layer of lived experience that is not lifted up and is a lot of times even further ostracized or pushed aside in the clinic room between a patient and a provider. That makes it harder for the patient to feel like they can open up. They can really share what their symptoms are, what their experiences are, what they're already maybe trying.
That's an excellent point because we hear it all the time. If you see it, you can believe it. If you see someone who looks like you feel like you can be more like that person. You can share more directly with them. It's completely on point when you're in the most vulnerable situation of your life. If you don't have that trust, how can you really fully share and be vulnerable to be able to then have agency for yourself? Because there's just a huge gap, a huge bridge to cross because this person's not going to understand me from a cultural perspective or what I might be going through.
Yeah. Another argument some people make is, oh, are we really talking about economic differences, not racial differences? But I think Serena Williams is a really good example of the fact that she is a quite wealthy, educated, well-known, prominent Black woman. But when she gave birth, she wasn't listened to. Even though she's very attuned with her body, she still wasn't listened to. And we see that disproportionately for Black women across the board. Black babies who are treated by Black pediatricians have a lower mortality rate. So we see like a very clear positive outcome from this race concordant care.
Beautiful. Love this. Tell me, where is Kyndred in its journey? And tell me a little bit more about your services and offerings and where can people find Kyndred?
Yeah, we're pretty early days. Like I mentioned, needing the scrappy adaptability of early stage startups. So that's the point in which we're at right now. It's pretty well known that women, although not well known enough, that women across the board do not get funding as much as men.
2.5% still. It's unbelievable.
And then when you look at that and you break it down even more racially, it's even worse for Black women. Just these extra layers, it's almost impossible to get funding. And it's very interesting when we're building something like Kyndred, which has so much market research behind it, so many clear numbers that this is something that's wanted, needed, and would have an economic benefit, both from a public health perspective of how much money we waste on health inequities, and also from more of a profit driven thinking about setting up a company and what people are looking for and wanting to spend their dollars on. We have everything aligned, but we've really struggled to find the funding that we need to get it off the ground. And so the approach we've taken is the standard bootstrapped approach, a lean startup. We're just building the first iteration of Kyndred and putting that out into the world. And we'll be out in just a few weeks here in February in Black History Month. So we'll be
Amazing.
launching to everybody. And while we plan to eventually be providing care across the lifespan of a Black woman, the entirety of that lifespan, what we're starting with is some pretty high need areas. So unfortunately, Black women, as far as disparities in women's health goes, we basically win on every single metric. We basically have the worst health outcomes on every women's health metric. So you could close your eyes and throw a dart on a board of women's health issues and we could cover anything. But what we're focusing on first is what we felt our care model would best serve. Our care model is integrated. So we're thinking really about the whole body, about holistic healthcare. We're not just doing a pill mill or traditional prescriptions, but we're really thinking about the whole body, the mind body connection. We're thinking about gut health. We're thinking about longevity and these things that historically we have just been sequestered off for that white, wealthy, well group, and thinking about bringing that to the people who really need it the most. And so when thinking about that, we decided on a few different service lines. So we'll be providing a program called Rhythm and Flow, which is focused on PCOS and hormone period repair. We'll be providing a service called the WTF visit, which is my personal favorite service, which I think every single woman should get a WTF visit, which is like, I have this constellation of symptoms. What the F is going on with me? What is happening? Every time I go to a doctor, they say, no, you're fine, or, oh, lose weight, or, oh, here's some birth control. And so that visit and that service is really focused on not dismissing, listening deeply to these women and figuring out WTF is going on. And then the last service that we're offering really is a timely addition to what we're seeing in the country, which is telemedication abortion. And we really decided to add that service given the attack on reproductive rights and the fact that abortion is a necessary medical treatment, a necessary part of women's healthcare. And you really can't give good women's healthcare without including abortion.
Exactly. And it is healthcare. I do feel strongly you have to take a stance and include that in women's health because that is serving the whole woman, the whole human. And we connected on this. That is wellness care for our whole population. It's economic care. If we're not providing this as an option and allowing women to make their own health decisions around this, then we are doing them a disservice. And that's not fair. It's not right in this day and age in the world that we live in. Black women and people of color have even a more difficult time having access to that treatment, to getting abortions.
Yeah. Also in a dignified way. The approach for Kyndred is very much, I will really credit Tia for this. It matters what it looks like, the aesthetics of care. We don't have to be getting care in dingy, dirty, blue and white and gray clinics. We can have things be beautiful. And I think for Kyndred, we are specifically focusing on what do Black women find beautiful? What do we find calming and what are little cultural touchstones for us that really make us feel at home, and really wanting Kyndred to feel like you go over to your auntie's house and you're sitting down with your friends or your grandma's, and there's all of these amazing pieces of what makes you you, or your family that you're able to tap into to feel more at peace and at ease. And so that is also what we want to bring to the abortion experience, as well as across the board of our clinical care, is that you're getting a dignified experience in a way that feels cozy to you, that feels comforting.
Love that. And to have that personalized care, to share in that expectation, it just creates a more accepting and welcoming space for people, which ultimately, if you are able, which I think telehealth has had a huge impact on it, but people being able to share in the comfort of their own homes instead of in the sterile doctor's office with the pink paper pants, whatever they might be, you just feel more inclined to just get the hell out of there. Whereas in this environment, you create that space where people feel comfortable. And that has to improve outcomes.
It does. Being able to just reduce the barrier of, oh, I don't want to have to go to the doctor. I don't want to have to see my provider. And it being a more pleasant experience is so huge in access and actual follow through. And now that we have a lot of great technology, we can do PAPs at home. We can do HPV testing at home. You don't have to go in and get undressed in that cold, sterile office. You can do it in your home. And when you look at the statistics of Black women in cervical cancer screenings and then cervical cancer diagnoses and outcomes, so bad. We need a better way. We can't just keep doing it the same way we've been doing it.
Exactly. Let's talk a little bit more about that, about the technology and the platform itself and designing for equity, not just demanding it. But you've said we don't have to choose between innovation and integrity, and that trust isn't slow, that it's sustainable. What does that look like in how you're building Kyndred and how you lead as a co-founder and part of this team of 3 dynamic women?
Yeah, where health tech broadly, I'll say, has gone a bit wrong is that there's a lot of amazing things that we needed to and should take from tech, big tech. But this mentality of move fast and break things was not something that was applicable or adaptable to healthcare. We're providing healthcare to people's lives. We have people's lives in our hands. And so this idea of moving fast and breaking things in the healthcare space has led to just so many horror stories. I mean, there's so many failed health tech companies we can point to be like, wow, what a scandal, what a mess. That was really, that was really bad. And so that's the grand scale things. But I think even on the smaller scales, if we in digital health, if we slow down a little bit in the beginning and we really work on building trust, Adrienne Marie Brown has this concept of moving at the speed of trust. If we really in the beginning time tap into trust, build trust with our members, our users, and use that to actually build what people need, what they're asking for, and scale that versus rushing in and throwing a bunch of things at it, we're going to be way better off both economically and ethically. Because at the end of the day, we are dealing with people's lives. We have that in our hands and we have a huge effect. And so I think that is one approach. Like I said, we're lucky in that we had 7 years of data and of connection with women and trust building with Black women before we even started to make Kyndred. But I think there's lots of ways to get that when you don't have that. There's lots of ways to build your advisory team, to build your leadership, to really think about how you're connecting with patients and the control you're giving to patients, how you're taking their feedback to make sure that that's baked into what you're building.
You mentioned it earlier in the episode, but when you're looking at healthcare itself, it is a very slow moving environment itself. So how can you go from the ants crawling in a space, waiting for approvals and diagnoses and if the treatment's going to work, blah, 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 to the speed of sound? There's a huge chasm there that you have to figure out how to cross. What drew you towards digital health as a space to create change in?
I a little bit stumbled and it was just the exact right place to fall. Because like I said, with Oliver's diagnosis, that drove me to telehealth during a time where it was starting to boom. And then my values and interests in women's health and experiences in women's health is what led me to TIA. And I joined TIA at a time where it was quite small, where we didn't really have a virtual health team yet. We had maybe 2 clinicians that were providing some virtual care. And I came in and I just really saw the opportunity to expand virtual care. And I had that passion and drive. I am a person who wants to fix things and wants to optimizing and doing. And so the right fit is that was an environment that wanted me to do that as well. Whereas traditional healthcare, I think a lot of clinicians who have that drive sometimes end up feeling like they're hitting into a wall. And so the digital health space, I found that people wanted people who were into solving problems and who were good at solving problems and who were willing to think innovatively and outside the box of how things had traditionally been done. And that's very much my vibe and what I like to do. And so I felt it was just a perfect match from the beginning. And I've just ran with it from there.
And it feels like it's a great fit because it's definitely an underserved offering, underserved population, underserved in terms of access, and really helpful for you all to be able to accelerate your ability to reach the women that you need to. If you were looking at an overall picture, what is something that you hope listeners would understand after hearing this, especially those outside of the Black community? And what would you want them to do to help Kyndred Health accelerate, take off, and get the funding that it needs?
If you're a funder and you're listening, fund us. If you have money and you're listening, fund us. I think that whatever your race is, whatever your cultural background is, being able to understand that a place like Kyndred needs to exist. It deserves to exist. We need it to exist. And that Black people, Black women specifically, have really, really needed this for a long time. And we deserve this type of space and care in the way that we access healthcare. And so I think understanding that it needs to exist and then doing what you can to help it exist, whether that's funding, amazing, or whether that's advocacy and policies that make a clinic like Kyndred be able to exist easier, advocacy and amplification in the way that you are spreading the word about Kyndred. Maybe you know someone who this type of clinical care would be really great for, or just spreading the word to create more brand awareness for us so that it is clear what our mission is, which is really to improve healthcare outcomes and experiences for Black women across the United States. And that was really important to us to have it be both experiences and outcomes. We don't just want to make Black women healthier. We actually want to repair and heal our relationship with the access of healthcare.
In doing that, it will also effect change in actual outcomes as well. You also have another initiative that you're doing called Together. I was inspired by this, but tell us a little bit more about what it is and how you are intentionally setting up a system to support caregivers and clinicians that are actually working within the system that is not working.
Kyndred's focus is on Black women. It's on Black women clinicians. It's on Black women patients. But as I said before, the likelihood that you're going to go into a clinic and you're going to be seen by a Black clinician is pretty low. And it's also not just Black women who are experiencing poor outcomes. We are experiencing pretty poor healthcare outcomes across the board relative to our country's income. It doesn't match.
Shocking.
It does not match. Like the math is not mathing on the fact that we have such poor outcomes across the board. And so really, Together came first. I created Together before I started doing Kyndred. And Together was really my response to identifying this system is not working. It's not working for providers. It's not working for patients. It's actually not working for the healthcare system financially. We spend a crazy amount on our healthcare system that is doing a bad job. What are we doing here and how do we do it differently? And so my approach with Together is to really focus on the healthcare provider as the point to enact change. And so thinking about the healthcare provider, first of all, as a whole human who deserves their own dignity and respect and care, and as the person who has a lot of power, even if it doesn't always feel like it, to change the experiences of their patients and the experiences of their coworkers. And so with Together, we focus on what's called collective care, which is this idea that all of our well-beings are tied together. And so the more of us that are healthy and doing well, the more of us that will be healthy and doing well. And with that, I created a framework called Ally, which stands for anti-racism, liberation, and intersectionality. Obviously, I didn't create those concepts, but it's adopting the principles of those concepts that many people have written about and we have studies on to make it a practical approach to clinical care. And that's really like the key part of Together is everything's super practical. It's not giving you theory or ideas or moral rants about what we should or should not be doing. It's really like you're telling me that patients with this economic background or this racial background can't access this medication. What do I do in that situation? Or you're telling me that my Black patient is less likely to tell me things. How do I change that? How do I get them to talk to me? What are things I can say or do or position myself in the visit? There's many studies showing that white providers have visits with Black patients that they will actually position themselves away from the patient. And it's not even conscious. It's not even they're like, oh, I don't want to face this patient. It's a subconscious separation that happens. And so how do we just teach a provider about that? Make them aware of that. Help them turn, make them face their patient, sit down, get on the level, have a script, all these practical things to help providers connect better with all patients and connect better with each other.
Right. And I feel very strongly that we are better together. And so when these support systems are embedded into a system of care, it gives more opportunity to, as you've mentioned with Kyndred, making that experience better because we're all humans. We all have our struggles. Does not matter the color of our skin. Something has touched our lives in a way that makes us feel like, what in the hell is happening? And if we can have that compassion for others, having very similar experiences, even though they may not look like us, then we can bring more humanity back into the conversation, back into the doctor's office, back into our collective consciousness and wellness care. Motherhood in America is at a breaking point, and moms deserve to tell the story. Moms First is a national movement fighting for affordable childcare, paid leave, and a culture that truly supports families. And now they're launching a documentary about motherhood in America. And they're inviting moms across the country to become associate producers of their film. Because for too long, other people have defined this narrative, and it's about darn time that we reclaim it. You can become an associate producer by sharing your story with the Moms First team. Just visit momsfirst.us to learn more. And let's make sure moms are the ones telling our stories. That's momsfirst.us, momsfirst.us. We're in a really difficult time. Last week, I joined a call to action with 7,500 women with Reshma Sojani. And as we all know what has happened with Renee Good and Alex Pretty killed by federal agents in Minnesota, it's so sad. And I feel like what is happening right now is really racial profiling. And unfortunately, as you said, it's unconscious that people do this, even in the hospital room. It goes back to like this growing list of people. It's not just Renee Good and Alex Pretty, who obviously were both white, but it's George Floyd, Breonna Taylor, Eric Garner. The list goes on and on and on of how this social injustice, racial profiling, and discrimination continues to persist in our country. And now you're building a healthcare model for Black women in a country that continues to criminalize and devalue Black lives. How do you process that right now?
To be honest, it's been difficult. I think it's difficult for all of us. And one thing we did at Together is a platform. We're an app, and we are also a CE accreditor. So we accredit different education using this Ally framework. And then we have an app where providers can join and get support.
Where can people go to find that?
That is togethernow.com.
We'll put all of this in the show notes too.
We've done that to try to come together a little bit more because it is incredibly difficult right now. For many of us who have been activists for a long time, for many of us with lived experiences or identities that have been under attack for a very long time, this feels like an escalation, but not an anomaly or not out of nowhere. It feels like the widening of awareness of what was already happening under the surface for white people. Now we're seeing white people also being targeted in a way that Black people are already targeted, or we were already detaining and imprisoning families. To gather way long ago came out with a zine called Care Not Cages of how to navigate ICE. And that was before this escalation. So these are issues that healthcare providers have been dealing with for a while. These are issues that our communities have been dealing with for a while. How do we take this moment to come together and really say, hey, look, we said this was happening. We said this was bad. We said this is bad for all of us. And so now you're starting to see a bit more of that. And so what can we do? Because we actually do have a lot of power. If we are collectively coming together, we have a lot of power. And unjust systems across history, across the world, have really thrived on keeping people separate and really making people's struggle feel unique to them. But this is a collective struggle. Income inequality disproportionately affects Black people, yes, and certain Asian groups and Latinx people, but it also affects white people. And it also keeps us in a mode of wanting or feeling like we have to be in survival so that we don't really question or push back on those in power. And so if we can see that the mask is off a bit and we can use this moment to come together and start to really, like you said, have compassion for the struggles of people who were struggling before, people who are struggling now, and start to really listen to each other and what we've been trying to tell each other and what communities have been trying to say for a really long time. This could be an incredible moment for us as a country to come together in a way that we haven't before.
It is, considering where we are now in this time and place versus, say, 50 years ago. We have the opportunity to do so. And I think we have, as a community and as individuals within this community, it is broadening that awareness and realizing this is unjust. This is a disservice across the board. And if it's impacting our community with people who do not look like ourselves, then it's impacting someone's family. If we all could have some compassion around that, because we all want the same thing. We all want to be happy and healthy and well, and we want our kids to grow up in a safe neighborhood, and we want to care for our community, for our neighbors and our friends. I think it's been pretty heavy lately. There is a lot of opportunity. What do you think is the role of health leaders, healthcare providers, even founders in naming and acting on state violence as a public health issue right now?
Like, first of all, what you just named is just the tenets of reproductive justice. So reproductive justice says we should have the right to have children or not have children and parent our children in safe neighborhoods and in the way that we would like to. And so that is the tenets of reproductive justice. So I think anybody who is touching on women's health, we owe it to that movement and to that work to engage in this, because with the worsening ICE patrolling and state violence from ICE specifically, we're seeing a reduction in being able to access healthcare because people are afraid to access healthcare. That's also something we've seen in the past, but it is definitely worsened lately. Right. But even beyond ICE, in neighborhoods that have heavier policing or have more stop and searches and have more police brutality, we've already for decades and decades now seen that the rate of preterm labor is higher in those neighborhoods. And so we see a direct effect. The stress of that, even just the knowledge that's happening, the witnessing, that's one thing that is a really tough one that I don't feel like we're talking enough about, which is the vicarious trauma that us as a whole country are witnessing currently. I mean, that we've been witnessing for years now and lots of different issues, and what that's doing to our body, our ability to have a long health span. What are the effects of that? And there's a lot of like insidious effects that we're not even seeing yet that come from witnessing that much vicarious trauma, whatever our political beliefs are. Even if we're on the side of deporting undocumented people, us witnessing this sort of violence, that has a lasting effect. And so I think mental health providers, if you have employees, basically every single person should be concerned by what's going on, because it's going to have an effect on every single person that's witnessing it.
100% could not agree more with you. I was listening to something about collective trauma, and we need to start talking about that. We need to be having dialogue around what do you do? Because it's so much and it's instant. Social media has made everything at the ends of our fingertips. No one should have seen what happened on TV. This goes back to George Floyd. We are seeing this instantaneously, and it's too much. It's too much of a burden for any of us to bear. And it's happening so much more frequently, sadly, and we're seeing it so much more. Our kids are seeing it so much more. As a clinician, what would your guidance be to people right now who might be struggling with this trauma? Everybody is.
Yeah.
As you mentioned, if you're on the side of deporting undocumented folks, you still want your kids to go to a school and not have to worry about it being inundated by police force for seemingly no reason. You want your kids to do well. You want your kids to be happy and feel safe. What do we do?
Yeah. I think for many Americans right now, there is just some level of acceptance that we need to have that we are in. I'm trying not to use inflammatory language, but at a certain point, you have to call a spade a spade. We are
Yeah.
dealing with a fascist government. Many countries before us, and hopefully not, but perhaps many countries after us will deal with fascist regimes. This is not a new phenomenon. I spend part of my time in Spain, and I think Spain in particular has a lot to say on what's going on in the US right now because they pretty recently had a fascist dictator until the 70s. And so a lot of people here remember what that was like, and they're seeing the same thing play out in the US. So I think, first of all, in the US, we have to just acknowledge what's happening because if we try to bury our heads in the sand, it's going to get worse and worse and worse. That being said, though, acknowledging what's happening and acting about what's happening does not mean we have to take endless input of information. And it certainly doesn't mean that we have to take in information in ways that are activating for us. So that would be like your videos, the automatic videos that play or another. It actually is having the opposite effect because it desensitizes us from being able to act. It makes us frozen. And we don't want people who are frozen right now. We want people who are actors, who will do. And so I would say to figure out for each individual to reflect on what is your limit? We all will have different limits at different times. Maybe some of us are parents. Maybe some of us are working really difficult jobs and we can't just ignore our jobs because we're the sole caretaker for our family. We're taking care of a parent, et cetera, et cetera. The list goes on and on and on. And so
Right.
for every person, we're going to have a different threshold of what we can intake and how we can act. For every single person in America right now who does want to do the right thing, who does want to push back and does say and is saying, whether you were right or wrong before, who is saying now at the very least that this is not okay, every single person in the US right now should decide, okay, what is my threshold of information I can take in? What is the best modality? Is it reading an article? Is it listening to a podcast? Is it talking to a friend and my friend's going to filter me the information? What's the way I can take information that keeps me the most sane and able to act? And then what are the clear actions I can take? Because just taking in information actually isn't doing anything. You have to
Right.
then act on that information. And so make sure that you don't hit the tipping point that makes you then frozen and not be able to act.
I can admit I experienced that just last weekend. You hear something new and then you just are totally paralyzed. And it is mind numbing, it is physically numbing, and it's exhausting. And as a whole community across the United States, it is too much. Another thing that some of the folks in my circle have suggested as well is move, get this out of your body, do something, take action. It was with this call to action for Reshma Sojani's group. There was a live event, Motherhood Live, with Reshma Sojani leading it, but Ilana Glazer was on, Emily Oyster, Gloria Steinem, Anna Malikia Tubbs, Katie Bethel, Shannon Watts, Erin May Quaid, and I may have slaughtered many of those names, but ultimately the conversation was around women showing up, women taking action, because women of all color are the latest target. It is urban women who are really advocating for this are now the target because we're not compliant. We're not just being part of the system and accepting it. And I don't think that any of us can afford to accept this right now. So it is move your body, take action, call your senators, and then take care of your neighbors. Reach out to your community, check in, host meals together, reach across the quote unquote aisle and have these conversations in a really genteel, compassionate way because we're all struggling.
Yeah. That's a particular call out that's maybe not my most popular take, but it's really important specifically for white women. And I'm biracial, so my mother is white, but I think it's particularly important for white women to also look into their history right now because there's a history of white women in the United States. They have both been the victim of white men and also the oppressor of people of lower social status as them. So thinking about the specific histories, like white women during slavery, for instance, were often the worst perpetrators of the horrors of slavery that we think of towards Black people. They were often in charge of some of the management, especially of enslaved Africans in the household. Thinking about during the wave of the feminist movement and thinking about the way that white women told Black women that they would include them, but then really didn't when the push came to shove to include them. And during all of these times, white women are also getting incredibly oppressed by white men, incredibly oppressed by men. And so thinking about this system's desire to keep people separate and desire to pull apart and to keep people not in sync with each other, and thinking really about what are the reflections that maybe white women need to do right now that they are, like you said, being targeted in a way that they hadn't been before. And so how do they take this moment as a moment of reflection and then of action in a way that's different than how they acted in the past? Because I think there's been different times of movement in which white women join in, and it doesn't necessarily have the best outcome for Black women, that they're not necessarily brought to the table when white women do get the seat at the table. And I think that's part of the building of Kyndred is to look like, okay, when the push came for women's health tech, what women were included, what women weren't included. And so think about how that can also be playing out in the current movement that we're seeing and how much stronger we can all be together.
Could not agree more. Check your privilege, check your access, and check how you can be a better ally. And not just in words, but actually following through on those actions. Imagine if your healthcare actually saw you, believed you, and was built from the ground up just for you. That's Kyndred, a Black-owned digital health platform transforming how Black women experience care. If you're tired of being dismissed, rushed, or piecing together answers from TikTok and group chats, Kyndred is your new home for whole person care. From painful periods, PCOS, fibroids, and hormone chaos to sexual wellness, gut and metabolic health, and trauma-informed mental health support, you get one connected space to be fully cared for and taken seriously. Kyndred is grounded in Black feminist values, reproductive justice, and pleasure-centered care, taking seriously the toll that racism and chronic stress have taken on our bodies and actively working to repair that. Kyndred is gearing up to launch virtual care in March 2026, and now is the time to get in early. So join the waitlist. Bring your questions, your WTF is going on with my body moments, and your desire to feel better for real. Visit withkyndred.com. That's WITHKYNDRED.com to learn more and save your spot. In terms of healthcare and health tech this year, what do you hope is one action that more women will take for themselves and for their communities, for their families?
Yeah, I think that we can demand more. I think that women across the board, we can demand more and we can do things differently. We don't have to recreate the way that men managed, for instance. We don't have to lead the way they lead. We don't have to create companies the way they create companies. We can think of different ways of being and we can demand what works for us. I think that there are some interesting companies out there modeling this. I think of Bobby as one of the companies, that a formula company, which as a lactation counselor, I have some critiques of as a Black lactation counselor specifically. But I will say what's really interesting about that company is the different way in which they're leading, and they're thinking about what leadership looks like, from things like maternal leave to what does it look like to bring children to work. We can be doing things differently as women, really coming together to say we don't have to be recreating these systems. We can choose something differently because we know
Yeah.
better and we can do
Yeah.
better.
And we should demand more, because if we don't, we're going to continue this same cycle as well.
Mhm. Yeah.
How do you feel like we keep showing up for each other across race, across roles, and across systems? What do you feel like is most important in that regard?
Listening and reducing defensiveness across the board. You can apply this to the company setting. I don't know if you've ever had to give feedback to a founder about their baby, which is what their company is. Having to give feedback to a founder of, well, this is what the members or their users are saying. We might want to pivot this way or that way. There's a lot of defensiveness that comes up. And usually defensiveness isn't coming from this horrible place. It's coming from some kind of hurt or some kind of concern or worry or anxiety. And so I would say for people to really be thinking about, what are those for you? Where do you notice yourself raising your shoulders and getting more defensive? And what are ways that we can reduce that for our nervous systems, for ourselves, for each other, and really start to listen deeply to what other people, especially people who do not look or talk or have the same resumes as us, how can we listen more with them?
Great point. And so true. Couldn't agree more with that statement. And I think it's so hard as well. But I think if you just hit pause, I teach yoga and often say the power is in the pause. And I think it's true. And I think our whole country needs to hit pause. We need to have a reset button right now, because we do also have the opportunity to make things exponentially better for everybody. And if we did that just through listening, through hitting pause for a moment and being compassionate humans. And we all have the ability to do that. Is there anything that is like burning on your heart that you want to share?
This goes to that together framework of allies, specifically the intersectionality piece. That's a word sometimes that can get lost for folks or not have a clear meaning. While not the specific definition of intersectionality, I think the idea of how do we honor our full selves? I think of this just as a mother, a woman in the workforce. How do we keep in mind all of our different layers and our different privileges or disadvantages? And how do we start to think about that on a more macro scale? I think start with yourself, be able to do that processing with yourselves. Think about your community. How do we include maybe people who we weren't usually including, or think about the different needs? And then how do we do that also as entrepreneurs, as business people, as founders, et cetera? How do we start to think about that within our work, either how we're engaging with our employees? How are we really taking a wider view of how everything at play right now is impacting the people around us and what that might be coming out in our work? Because I do truly believe this. I believe that the people who are going to win, who are going to be successful in the long term, are not the ones who rushed to scrub their website of DEI, or not the ones who decided to fall in line. Those are not going to be the people who are successful long term. And we have plenty of history to prove that. It's going to be the people who chose to be bold during this time. It's so much easier to be bold with other people. And so I really want to encourage people to expand their view, expand their reach and who they're connecting with and how they're thinking about things during this very tumultuous time.
I am so grateful you were here today, and thank you for sharing that. We really absolutely don't need any additional proof that the system is broken. Leadership is hard, mothering and daughtering is hard, being a human right now is hard. And we need more models for what healing, justice, and care can really look like. So thank you for the work you are doing. You are reminding us that we can build what we need, that we can slow down and be really intentional about this framework and create access, opportunity, and better experiences for everybody. And we don't have to wait. We can do that right now. And so for especially those of us who hold privilege, whether that is being having the opportunity to start a business or be a stay-at-home mom or be in the workforce, this is the moment to use your privilege. So sisters, daughters, aunties, mothers, this work is for you all. And it's going to take all of us together. Thank you so much for being here, Tesiah.
Thanks for having me. Yes.
Appreciate it. Thank you so much for tuning in to Redefine Her today. It means a lot that you're here. If this conversation resonated with you, please be sure to like it and share it with your girlfriends, your partners, and anyone who needs to hear it. Yes, that includes our men who are allies as well. Don't forget to follow the Redefine Her podcast so you never miss an episode. This season, we're diving deep into real-life stories of bold women taking giant leaps of faith to create better access to legitimate care for all women. From the clinic to the boardroom, from lived experience to systemic change, these are the conversations that redefine what health and healing can look like. I'm your host, Brenda Armstrong. Thank you for being part of this community, and we'll see you next time.